So your hip pain keeps coming back. Why is that? In my last video, we did a routine that decompressed the fascia so that we got relief from the hip pain that we're experiencing. But it may still be coming back because you can't just focus on the hips in order to get a lasting result. And that's what I'm going to share in this video today. So hello, my name is Catherine and I support people to free themselves from pain so that they can move pain-free every day. So let's get started. So if you completed the routine that I showed you in my last video, you will have been decompressing the fascia in and around the hips. This would have given you relief, and hopefully you repeated it more than once to get that relief each day. But the hip pain may still be reoccurring and you may not have got rid of all the pain because it isn't just about the hips. So the whole body is connected. So when we do not stand correctly, it isn't just the hips that are affected. So if we hyperextend the knees, for example, we're locking the knees, that's going to tilt the pelvis forward and that is going to put pressure in the hip areas as well as the knees. So if we are just focusing on decompressing the hips when we might need to decompress the knee area or the rest of the leg, then we're not going to be able to get rid of that hip pain. So we need to take a full body approach, and that's what block therapy does. So when we just look at our hips and we just decompress the hips, we will get some relief, but when we take the full body approach, that's where lasting relief takes place. So with block therapy, we look at all areas of the body. Every part of the body needs to be decompressed. Even if you can't actually feel the pain, when you lie on the block or the rolled up towel, you will feel the pain come to the surface, and then you can breathe diaphragmatically and melt away that restriction, that pain. When we are tight in certain areas, we may not always feel the pain in that area. It can be the referred pain, and that can happen in the hips. This was the same for me. I had lower back pain for as long as I can remember, and I always thought it was my back and what can I do to support my back. When I found block therapy and started to release my hips, my back pain got better, and that's because I'd fallen into my core. So I was tilting forward. I wasn't standing correctly, I was shifting my weight to one side, so I was getting my pelvis out of alignment, and that fascia had twisted and turned and locked me, so my tightness in my hips was affecting my lower back. Once I released the hips, my lower back no longer hurt. So it is about looking at where the pain is, but also looking at the full body so that we can get a lasting result. And then when we start to breathe diaphragmatically, and this becomes a habit and we do it all the time, not just when we're on the block or rolled up towel, this helps the body to get that oxygen it needs. So when we chest breathe, we have 6 times less oxygen in the body. When we're holding our breath, our body thinks it's in a stress and fearful situation. So we should always be trying to breathe diaphragmatically. And this does take practice, but the more you practice, the more it'll become a habit and you won't need to think about it. So making sure that you're breathing in through your nose and out through your nose wherever possible, keeping that mouth shut unless obviously you're talking. You want to be putting the tongue in its right place as well to help support the head and the neck. In my other videos I talk about tongue posture and also diaphragmatic breathing. So you want to be creating the space, and we do that with the block or the rolled up towel, and then we want to inflate the space, and we do that with the diaphragmatic breath. And the last thing is to maintain that space, and it's about being aware of our posture, making sure we're always making those adjustments when we notice that we're not standing in a correct alignment. And again, this takes practice, but it is something that becomes a habit the more that you can do it. In my online classes, we look at the whole body. There's 3 main classes and we rotate through all of the body so that every single part is covered. If you're interested in joining an online class, the link is in the description. These classes are for everybody, even if you've never done fascia decompression, block therapy before. All you need is a rolled up towel to start with, and when you join an online class you'll get a video to show you how to roll up a towel, but it is as simple as folding a towel and rolling it as tightly as possible. You will then use the rolled up towel in the classes as I guide you in and out of position. If you've got any questions on the classes, please let me know. and I look forward to seeing you in class soon. In my description, I also have a guide that you can download for free. And in this guide, it talks about the 3 simple steps that you can do, which just takes 5 minutes a day to start releasing that pain and stiffness in your body. So thanks for watching, and I hope to see you in class soon.